Myself, Dr. Deepthi Shetty, Clinical Administrator of Image Hospitals and founder of Exam Academy, practicing since 15 years. So the right age to choose your retinols, why? Because most of the people start with the retinols in the too early teenage. It's definitely not recommended. Going with late 20s or around 25 is definitely good option. Why? Because in the 20s your collagen production starts reducing, which leads you fine lines, starting up with the wrinkles and other changes in the skin will be happening. So in the late 20s and in around 25 plus, you can definitely introduce retinols. Even in the early teenagers, if they have any stubborn concerns of acne and all, definitely it can be recommended with the retinols. But following a good sunscreen and hydration is mostly enough for the basic teenagers. When it comes to beyond teenage, or when they cross with the teenage, they can introduce definitely retinols to prevent their sagginess or fine lines, wrinkles, making your skin firmness and all definitely will help with. So definitely retinols has a few drawbacks if it's not used in a proper way. So it may end up with making your skin more sensitive, dryness, itchiness, more peeling, sensitivity, and making your skin more sensitive. So in that way, definitely retinols will give you lots of side effects, but it has to be used in a proper way. When you are introducing your retinols, so that time you have to start twice in a week in the nights, and then gradually increase with, and then you can combine with a very good moisturizer to reduce that irritation and itching. And don't combine with high grades of AHAs and BHAs or vitamin C along with that, so which may give you more additive effect like irritation and all. So definitely with the sunscreen and moisturizer and the basic introducing with the retinols in twice in a week, and then increasing with the skincare routine definitely will help you to a very good extent. Never try to accommodate retinols in the early teenage with usage in a high frequency. Definitely going ahead smaller proportions and in a daily routine will definitely help to reduce your anti-aging signs, fine lines and wrinkles. So introducing retinols to even sensitive skin is also definitely a safe only, but when we followed with a few norms. So retinols generally people start with 0.1 to 3.3%, but nowadays we can start even with 0.05 as well, which has been recently launched into. So when you start with the basic percentage, definitely it minimizes your sensitiveness over the skin. As in the sensitive skin, people start with the basics 0.05 to 0.1 and then pair it up with a good moisturizing things and minimize that usage weekly once. And if you still feel too much of irritation, go ahead with capsulated retinols or with bakuchiol or the retinoldehyde as an alternative. So can we use retinol around the eyes is also one more question. So when it comes to around the eyes, as the skin is more sensitive and thin in this area, chances of irritation will be more. So in that concerns, definitely you can use with the serums which includes with the proportions of retinol to minimize with the irritation and give you with the good changes. And definitely pair up with a rich moisturizer combined with this, so that it minimizes the irritations and the other side effects as well. And when you are applying, just dab with the serums, not like too much of application over that. Along with the retinols and the good routine in the home care and the lifestyle changes, along with definitely will give you a very good results. So which is obviously a best option, either retinol or bakuchiol in the early starters, like who want to start up with the retinol is the major question in everyone's mind. So retinol and bakuchiol, when compared with both of the things, generally it is recommended initially as a startup or the trial startup with the bakuchiol, and then gradually you can move on with the retinol. As bakuchiol is a plant-based retinol, it doesn't have the side effects like dryness, flaking or plunging, which will be created with the retinols. Definitely it's a very good option to start up with the bakuchiol and then move on with the retinols. And definitely with people who have sensitive skin or eczema or rosacea conditions, start directly with bakuchiol. There is no alternative going ahead with the retinols in the early times.